Udo, lovely to meet you. Would you introduce yourself and describe your research in the biobank?
Yes, my name is Udo Jeschke, and I'm the head of the research laboratory of the Department of Obstetrics and Gynaecology, and my research is divided into two parts. One part is research on cancer, and the second part is research on placenta and on gestational diabetes and placenta research and on the HELLP syndrome. And why these two parts are connected in my feeling. So all the procedures, the inflammatory procedures, the biochemical procedures that we find in the carcinoma, they come from the placenta. And what is also interesting for our research in gestational diabetes and HELLP syndrome research is that, especially for gestational diabetes, we know already that that there is a kind of programming of the child, that the child has a high risk to develop type 2 diabetes later on in life. And for preeclampsia, we know, and HELLP syndrome, we know that there's a high risk for the mother and also for the child that they develop some diseases, some heart diseases, circulation problems. And that's why we think that this research is really important. And the biobank helps us really much. The biobank gives us the possibility to collect or to make large collections of tissue samples, good quality tissue samples. And the second part is that we can collect blood either from the fetus, from the umbilical cord, or from the mother, and also investigate it. And a gut structured biobank is necessary to provide good quality material that we can do research later on.
You're doing research and dealing with the most personal samples that somebody could give. Can you describe the relationship you must have with clinicians to be able to have those samples available?
Yeah, for this kind of research, you need a very close connection with the clinicians. The clinicians are also responsible to divide the patients groups, especially for gestational diabetes. You can say you need four major groups. You need patients with normal BMI and have no diabetes, and you need patients with low BMI or normal BMI with gestational diabetes, and then you need the adipose group of patients. Adipose patients with diabetes, with gestational diabetes, and adipose persons without gestational diabetes. And clinicians are responsible for all the testing and responsible for explanation of the studies that we want to do, and also responsible for the patients that they give consent for being part of such a study. And of course, we need also from the clinicians some hot topics. They come with hot topics from the clinic. What is going on? Especially the adipose problem, the problem with adipose patients that is developing in our society, you can say. And this comes from the clinician, and from the basic researchers comes the methodology, materials, methods, especially the methods to investigate all the changes in the immune system. That needs a good cooperation between clinicians, biobank, and basic researchers.
That cooperation, though, relates to conditions that we used to think ended when the pregnancy ended. You know, you had your child, gestational diabetes, the risk would go away. Obviously, HELLP would as well. But you're talking about much longer health implications. So when you think about the impact of your research and what difference it will make to people in the future, how would you respond?
Yeah, because we investigate a special part of the fetal immune system, the macrophages that originate from the yolk sac. And the York sac macrophages, that are the principal cells of the immune system, the first part of the developing immune system of the child. And these cells go not only into the placenta, where they are called Hofbauer cells, they also go into the fetal body, and they develop into tissue-specific macrophages. And they invade the brain, the liver, all the organs. And they could probably be responsible for the fetal programming. And that's why we think that our research on the placenta, on the Hofbauer cells, is a connection to the problem. What is going on with the child? Why the child has a high risk to develop type 2 diabetes later on in life.
Thank you so much for your time. It's clear that your research will influence future generations.
Yes, thank you. And I hope that it will not only influence future research, but also future generations of clinicians and researchers to do such a kind of research.
You've described a really special kind of partnership, and that's been brilliant to hear.
Yeah, it is. It is not easy, but it can be done.